You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your Physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Which screen do you got?
Yeah, we got yours up right now. So if you want to go into presentation mode. Should be
Okay, perfect.
No, he's got this one.
Okay. All right. So, yeah, I'm Noel Blanco. I'm a third year over at Geisinger. We're part of the first class. And
I'm Aaron Lee. I'm a PGY1.
so, yeah, so our program has only been around for 3 years. So we're just pretty fresh. And of course, we got our standard statement that we have to provide. I think Dr. Chen, Leon Chen, he's our chief. He's currently available as well to discuss any other issues that we forget or questions. Anyway, so to start off, this is our outline of our presentation. So starting off, this is our leadership that we have. So Dr. Rosa is sports medicine trained. He's our program director. He's been it for the last year. Dr. Heinley is also my mentor. We have his wife, Patty, who's our program coordinator. And then listed on the side are our attendees that we have. The great part that I would say that I love about our program is that we make sure that we have a strong mentor-mentee program. So quarterly, we meet up with our mentors just to discuss any questions or issues or problems that we have, and if there's any suggestions that we have to help improve the program. So here's our entire group. Unfortunately, one of our co-residents was not available at this time for the picture, so we made some ways to make this happen, but we do have some get-togethers. Of course, with COVID, it's been difficult, but I know, like, for instance, I had a birthday party for my son, and some of my attendings showed up and some of my colleagues showed up. So we had a blast, and we're looking forward to trying to host more events as we do them in a COVID-friendly manner. So here's the list of our residents. So as you can see, we only have 3 classes. We got a mix of DOs and MDs and people with additional degrees. And I don't think I have everyone's listed, but this is on our website. And here's our first resident class picture that we were able to take. Starting off, we do have several training locations, but most of them are within about 10-15 minute drive from each other. So this right here is just a picture of the entire Geisinger system. You're not going to be rotating at all these sites, but it's just something so that you guys can see and relate to the rest of Pennsylvania. So first off, Geisinger Encompass Health Rehab. This is our inpatient rehab hospital. It is standalone, but it is on the same campus as the main Geisinger hospital. So similar to Penn State, if there are emergent issues that we cannot take care of, we'll just send the patient over to GMC, and it's a pretty close connection so that they can take care of whatever needs to get done that we don't have the capability of taking care of. And I'm sorry, we have 42 beds, free Wi-Fi, we got a courtyard, we're pet friendly, we got support groups, and plenty of vending machines, and it's a quick walk to GMC to get some lunch. Here's the main hospital. At the hospital, we have our consults, neuro inpatient, we have our brain injury clinic, EMG, and also we have neurology inpatient, and some of the intern rotations are also hosted there too. This is probably our furthest drive, which is the VA, which is in Wilkes-Barre, which is about an hour away from the hospital. We do provide housing so that you don't have to commute back and forth. Sometimes we're able to drive back and forth, but of course you have some long days, so you just want to crash over there, and it's a fully furnished apartment with a pool, gym, and around a lot of great eateries. At the VA, we do our interventional pain rotation, ICU, orthotics, spinal cord injuries, and acupuncture. But One of the big rotations that I will say that I've enjoyed the most was my first rotation in interventional pain at the VA. We were able to do tons of procedures. I was already involved with doing epidural injections, a lot of joint injections, doing EMGs. Basically, my attending was allowing me to act like a fellow. And in addition, I was involved with the multidisciplinary appointments for patients. So you had the pain specialists, physical therapy, pharmacists, psych, nursing staff, and they kind of looked at me as the physiatrist specialist to provide my input of suggestions for, let's say, the patient's back pain or the amputation or the amputee patient. So we also get to participate in prosthetics, again, acupuncture. The attending didn't let me do the acupuncture, but he did ask me some questions and taught me a lot. And lastly, Dr. Krosky is amazing. He was military trained, but he definitely takes time to provide didactics for us while we're up there. During intern year, the majority of the rotations are going to be at this hospital called Bloomsburg. Again, this is only a 15-minute drive. Aaron currently lives here in Danville. What, 10, 13-minute drive?
Like 13 minutes, yeah.
There you go. A small little parking lot, so you're in the front door within a couple minutes and up to the floor to start seeing your patients. And they also have a cafeteria. But this is also one of the places that we do have one of our offices for physiatry. This is a picture of our outpatient clinic, Woodbine. This is where we do sports medicine, orthopedics, and also there is a pediatrics. Pediatric sports medicine, and they also have radiology. They do outpatient surgical procedures. So you do have the option of doing some electives and selectives over here. This is our outpatient clinic for physiatry on the top left. This is the central clinic in Bloomsburg. That's where the majority of your outpatient clinic will be. And on the right, so occasionally we'll work with one of our attendings up there in Wilkes-Barre. Again, this is about a 40-minute drive, but we have the opportunity of seeing patients up there as well. And then also he gets involved in allowing us to do some ultrasounds on the patients and some other procedures. So our curriculum, we are a categorical program. So Aaron's gonna explain the PGY 1 layout.
Yeah, so PGY 1, you're going to be at 3 campuses at Geisinger, Bloomsburg, which is about 13 minutes away, Geisinger Medical Center, which is the main place, and the VA, which is about a 45-minute drive. You'll be doing 2 emergency medicine rotations, 2 internal medicine rotations, 1 ICU at the VA, a sports medicine, general surgery, 2 neurologies, a pediatric, 1 inpatient psych, 1 pulmonary/sleep medicine, 1 urology, and you'll have to study for step 3. Our program is new, so we're constantly evolving. Noel had different rotations than we did. We're constantly trying to improve so that, you know, we're getting ourselves better ready for years 2, 3, and 4, getting a good basis for those years. PGY 1 year is not as intense here, so it's pretty good. You have a good setup, you don't have call, and you do have lots of weekends off, which is great.
Yeah, but like you said, I didn't have a urology rotation, and we're seeing that is very helpful during our 2nd, 3rd, and 4th year. So to break down the 2nd and 4th year curriculum, we're rotating amongst these different sites. But again, remember, if you're going up to Wilkes-Barre, there is some travel time that's permitted, and of course, staying in an apartment. However, what's kind of nice is that we do have a mix of inpatient and outpatient. You'll have a total of 12 months of inpatient. You will do coverage, and guess what? It is home coverage. There will be attending available. Again, the VA rotation, doing interventional pain. We got a specific rotation for the EMGs, sports medicine, MSK ultrasound. You can do research, electives, and that can range from working with radiology, musculoskeletal, or you could do inpatient neurology, whatever you feel is appropriate. Our staff is willing to permit you to do these rotations. They find it effective. And of course, there's sports coverage and electives. Our didactics, so it's specifically for the PGY 2s and 4s. We're on a 12-month rotation. It's 4 hours that are protected Wednesday afternoons. We will have guest speakers. We've had transplant specialists, cardiologists, intensivists, ortho, sports medicine, come through. We do have workshops, EMG, ultrasound, physical exam skills, etc. We do board review, and we have journal club once a month, and we always have some food provided. Our program will purchase 3 of your core physiatry books, PM&R Recap, and plenty of other options. And there is CME money for your books, conferences. And one thing that we got to participate was the EMG conference last year. And I think this year, for us PGY3s, I'll make sure that we do the GATE conference this coming year. We do have a research institute, and this lists some of the things that we end up doing. It's attached with the established Musculoskeletal Institute, which consists of podiatry, orthopedics, and I'm probably forgetting, and the therapists. But what's great is that we're currently working on some projects. Again, we're a new program, but our attendings are working on virtual reality for rehab. There's brain injuries. And I will say currently I'm working on this QI project, which is showing improvement of pain in inpatient. And we've shown a significant increase of pain tolerance from 55% to 80% from reviews from our patients. So I think we're doing something right. This just shows what EMR that we use. I will say our one pitfall is that we do have 2 EMRs, but in inpatient it's with Cerna. However, Encompass uses Cerner, and I will say that Encompass is one of the largest inpatient rehab centers in the nation, so this might be beneficial to you. But while you're an intern and while you're rotating at GMC, we do have Epic, and then we have the different accesses to using it. Then we also have Tiger Connect. You just use your own cell phone, Apple, Android, Google, whatever, okay?
And for sports coverage, we have tons of sports coverage. I've gotten plenty of opportunities as a first year, and you have plenty of opportunities later on as well. There's all different levels, college, high school, pros as well. It's orthopedic based, and we see a lot of pathologies like MSK, fracture care, procedures, ultrasounds.
So here's some of the teams that we do cover professionally in college. If you guys want to look at this, you can see the specific list of high schools. Now, going to the fun stuff. What's kind of nice is that Danville is in a rural area. So my wife took advantage of the resident auxiliary group, and they provide spousal support for a lot of things, from drive-ins to dinners to wine clubs to book clubs, etc. And you can take a look at this later. And they also have an Instagram page. If you need more information, Geisinger website does have a wellness resource available. And this is just some of our personal wellness stuff where we just got together and just had some dinner. With COVID, we find multiple ways of entertaining ourselves. So we had this Cocoa Mix night. It's your choice if you want to add any extra ingredients. And then we do participate in charity. This was one of our Christmas drives. We had a wellness event, and what was we made trees out of wire, so hence Physiatry. And these are pictures of the local surrounding forests by Geisinger. There's a hiking trail, and this bridge leads into Geisinger. It's fun to run on. Things to do. We got Knoebels, which is 30 minutes down the road. Great great amusement park. It's free. And then we got the drive-in, the famous Bloomsburg Fair. If you've heard of the people of Walmart, check out the people of Bloomsburg Fair. We have wineries, breweries, hiking trails. Here's some pictures of the famous Ricketts Glen, which has over 30 waterfalls, and it's a 7.2 mile hike. I did it with my 2-year-old strapped to my back. We got lakes. We got Danville, a lot of places to work out, such as basketball gyms. And here's our chief shooting some hoops. Tennis courts, indoor swimming pool, plenty of options for gyms in Danville, also in Bloomsburg. And then rental properties. So here's options of looking for things, and it's actually fairly cheap. And this is a picture of my backyard when it was snowing. And as our colleagues at Penn State said, it's just a simple drive to different places. As you can tell, here's some of the cities, but here's some of the favorite places that my wife and I and my son like to go to: Rehoboth Beach, going out to DC. So here's our contact information: Patty, Dr. Rosa, and of course our chief. Here's our mailing address and our phone call. And if you want any other further updates, you could also check out our social media. So with that, any questions? Teamwork, make the dream work. Did it work? So favorite thing living in Bloomsburg, plenty of local restaurants. There's, what else?
I'd say the hiking around here is really good. We got the Poconos really close here. We got lots of skiing. But I'd say if you're an outdoors person, this is the perfect place to be.
And it's super cheap. It only costs like, you can get a place for rent for less than $1,400, maybe even $1,000. And another thing, like my mortgage right now is only $1,100. So adaptive sports option. Unfortunately, because of COVID, we haven't been able to work on that part yet, but I'm hoping that we gear that up unless.
Yeah, actually, we're starting a Paralympics program here, but we are, it's in the works, but by the time you guys get here, I'm sure it'll be up and running.
Got about 5 minutes left.
All right. So the next question, what is the most challenging and what is the best part of being in a newer program? So if you talk to my colleagues and I, it's been fun and challenging. I will say that we've had a lot of nights where we've had to do a lot of administrative stuff. However, the input that we put in has been very effective. So for instance, there were, the core books that we have from Kukurulu to Bradham to Delisa. I mean, we asked, hey, we want these books, and they were able to give it to us. We wanted PM&R Recap. They were able to give that to us too. In addition, when we saw that there were rotations that weren't working, we told them, and they immediately changed them for us. But I will say that, yeah, we're setting framework. And I will say that this isn't my first rodeo because my med school, I was part of the third graduating class. But I think by the time you get here, we will have a stronger system going. And I think COVID did kind of slow things down for us, but we're advancing. And I will say that we got high accreditation. So ACGME likes what we're doing. And I will tell you that being the first class, we've had a lot of inpatient experience. And, one of our colleagues has already put 8 months of inpatient, and I'm about to get to my 8 months, and I've only been doing PM&R for now 14 months, but I feel comfortable working the floors on the weekends.
So I would say as a PGY1, why I chose a newer program is because nothing's set in stone, and they emphasized that during my interview, that nothing's set in stone and you can make the program how you like it. And so you can, if you want to take it in a different direction, you can bring this up to the program director. All the program directors and staff are really amenable to your opinion. So I think that's a huge advantage.
Yeah. And the nice part, so kind of falling into this next question, like, why did you rank the program so highly on your interview trail? So I will tell you that when I interviewed, I thought there was a class ahead of me. So when I showed up to the interview dinner, I was surprised that the first person I met was one of my attendings, and he's actually my current attending in inpatient. But what I enjoyed is that we're very, very family oriented. We're very, I'm going to say, we maybe this word might be not the correct word, but we're very, how can you say, fraternized? Like I don't know, like we're close with each other. We can talk to our attendings about anything, and we're comfortable discussing anything with them. If we have questions, we can go directly to them and ask them for help. But fortunately now you're going to have us upper residents, but you could ask us the simple questions like, hey, how do you order potassium chloride or something like that, or schedule the medications? But if there is the more complex questions and you want to ask like, hey, which stimulant medication should I give for this patient with a brain injury, our attendings are willing to answer that question for you if we can't help you.
Yeah, having just gone through the process that you guys are going through, I think during the interview trail, I got a really good feeling from the attendings, and I knew that they'd be supportive. And once I got here, it was definitely, it definitely showed through, because the transition from being a medical student into being a resident isn't easy, but I've got plenty of support, and I think that's made the transition much more easier. And I think learning in such an environment is much better.
And also, wanted to talk about experience with Dr. Rosa real quickly. Your rotation? Did you do a rotation with him yet?
Yeah, I did. Yeah. So my first rotation was with the program director, and
It's a sports medicine
Yeah,
rotation.
it was a sports medicine rotation, and it's hard to make the transition from a medical student into having much more responsibilities. But he eased you into it, and he was all about teaching. He's one of the best teachers that I've ever had in my medical career, and he actually has gone through special training for medical education, so he knows all the tips and tricks of how to deal with a new learner.
Yeah. So last thing, like he makes sure that he has all the PGY1s rotate with him, because he will work on your weaknesses. He'll make sure your strong points are stronger, but he'll also bring up your weak points. And I had the opportunity of rotating with him in my last rotation of my PGY2, and I wish I had that opportunity like Aaron to work with him during first year. But he's fun to work with, and he makes it very entertaining. You'll see.
Yeah.
And that's all that time we have today, guys. So sorry about that, but thank you so much for taking the time out. Props to you guys for working through your technical difficulties. Really nice to hear from you guys, and really appreciate you guys coming out today. We have Michigan State next.
Thanks, Penn State.